Hi folks, Marcel here back with The Pulse. Now recently I interviewed Dr. Xinjiang Xing of Augusta, Georgia, who was a longtime academic professor in the areas of genetics and biotechnology, and we spoke about NMN and other NAD precursors in our previous section of our interview. Now today we talk about NAD shots and infusions. Now there's been a lot of controversy about this topic, and I wanted to talk to Dr. Xi because he's done the tests. He's done more tests than anyone else on NAD levels in the cell. So I wanted to know, what are the outcomes from NAD boosting? Has he done those tests? And he's done a lot of those tests, and he had a lot of things to say. First, he's going to focus on some of the good things that NAD shots and infusions have done for patients. But he also lets us know I'm not going to like the complete answer. NAD infusions. Since we're on the NAD boosting, and this is a very popular thing. There are literally thousands now of locations in the U.S. and every city where you can get an NAD shot or an infusion. Pro athletes are doing infusions. There are a lot of them just raving about, like NFL players, NBA players. What's up with the infusion, or what's your take as from a test?
They are not going to like my answer.
What's that?
They are not going to like my answers to your question.
I'm not going to like them.
No, they are not going to.
It's okay, because I'm not a proponent one way or another. Yeah. I'm also not going to diss on something that people are claiming, as you say, is helping them. What let us hear it. What's your take on
it? Let me. I'm not anti NAD IV infusion.
Okay.
So NAD IV infusion has been very useful in treating two categories of symptoms or diseases. One is neurological conditions. You mentioned the Parkinson's, dementia, autism, and also is may provide a very good effect on addictions. And so that's a big area of application of NAD IV. The second area that seems to be very beneficial is infectious diseases. Many years ago, almost 20 years ago, Lyme's disease was the first one that was treated with NAD IV with very good outcome. More recently, various clinics are using NAD IV to treat COVID, especially non-COVID related.
UCLA, I heard was
there are many. I work with many of them. Okay. So that's the good news.
So that's the good side of NAD infusions. And we've talked about some of these things before, that you can treat conditions like Parkinson's, dementia, autism, and addiction, and they're getting very positive results from NAD infusions specifically. Also infectious diseases like Lyme disease and long COVID. But what is it that I'm not going to like about the NAD infusion answer?
So NAD IV, if it's used for the right indications, can provide benefits, and at least in those two areas that we discussed. However, NAD IV does not increase intracellular NAD, not at all.
Does not increase what?
It does not increase NAD inside the cells that we call intracellular NAD.
Okay, right. Now, the intracellular. So how is it benefiting neurological diseases without affecting intracellular activity?
I know you are going to ask that question, so I'm saving the answer. So
I'm not a doctor, but I play one on YouTube.
Yeah, you're good. You are very knowledgeable.
So NAD infusions do not raise NAD levels in the cell itself, as would be the case with NMN or even NR. So how is NAD providing such positive results for these conditions and diseases?
So now there are receptors on cell surface for NAD. Okay. So in the neurological system, NAD can be considered as a neurotransmitter. And in the immune system, NAD is a ligand for NAD receptors on immune cells. That's why these are the two cell types that we have found the NAD receptors on. And so the NAD can serve as the extracellular NAD serves as ligand or neurotransmitters to change the signal transduction inside the cells and modify the cellular function. That's one mechanism that I believe is definitely in play. The second mechanism, I think it's very likely as well, is NAD gets degraded very fast in the blood. And after 6 hours, NAD is gone in the blood. And it becomes NMN, becomes NR, also becomes other NAD metabolites. And as we discussed, these NAD metabolites also have biological functions, and they can provide benefits to the body. So the whole thing, as you can see, is a temporary, short-term benefit, right? And that's consistent with clinical observations as well, because you get some short-term boost. Even some people claim that you get a short-term boost in energy, in other performances. I mean, I think there's some placebo effect going on as well, but there's some real biological benefits as well.
So NAD is impacting the neuroreceptors outside the cell. Also, NAD breaks down into these metabolites, which offer you other health benefits, such as having NMN and NR in your bloodstream, but they don't raise NAD levels themselves. I then asked him about these NAD clinics. Has he spoken to them? What is he telling them? And what advice would he give them?
I get a calls from NAD IV centers every day. And I have to educate them. And what I'm trying to tell them is, you want to choose the right indications for your NAD therapy. And if you want to provide them to people who want to improve their health, you at least have to follow up your IV treatment with NAD precursor supplement.
So like a maintenance dosage
where it's not right to call it a maintenance dose, because you are not boosting it up anyways at the beginning.
Right.
It's a complementary. I wouldn't call it a maintenance, because maintenance to me has a different meaning. The clinics that are following the science and modify what they are doing are going to be the successful ones in both delivering patient care outcome and economically and commercially. And so that's a very important point. They need to learn the most updated science and change what they are doing. I'm not saying what they are doing is not good, but you can do much, much better.
So the takeaway is here, if you have a disease, if you need a fast intervention, NAD shots and infusions, especially infusions, can offer immediate, fast impact to treat various conditions and diseases. It can be a very good thing. However, after the fact, you should be taking NMN for a long-term health benefit. Another thing I should add is at no point in time did he suggest NAD infusions as an anti-aging treatment. This is much better performed by NMN because it stays in your body and can perform long-term benefits for people. So again, I really appreciated Dr. Shi's insights from his testing. NAD infusions at places like the NAD Clinic are very positive treatments for a plethora of diseases. Also, they seem to help really well for recovery times when providing surgery. Again, it's a fast-acting treatment. But for longer-term treatments, again, NAD precursors such as NMN. Thanks for watching. See you next time.